Hey, it's Bram Duffee for Health Communications class. We're working down the final stretch, and I'm happy to see you guys to talk about Chapter 16 today. We're looking at health communication on risk and crisis communication. And I'm just coming off of doing a live podcast episode called Hypnosis Hero. So if you want to check it out, it's pretty cool. I feel like I'm just like a media mogul today, going from one to another, getting to be with you all now. And so it was an opportunity for me to talk about my book and about how health communication can work out with some of the effects of using hypnosis. So pretty fun time. Like I said, if you want to check it out, it's called Hypnosis Hero was the podcast, and you could just type that in with my name to find it. So now I'm over to talking to you all about health communication on risk and crisis communication. And getting to talk about this topic really pushes me back to my days of working in public relations. And this was also my undergrad study, and certainly has affected my view of how things work in the business world and how communication is structured, because it's helped me understand that most everything is good happens through planning. And the thing is that if everyone doesn't understand what that planning means, and the importance and everything that goes with it, then we can have leadership that doesn't follow through with those plans, or that messes things up. So the cases of leadership problems during a crisis that go most awry, in my opinion, are in those cases where there's a plan that doesn't get followed. And so sometimes because the organization's embarrassed or they're trying to cover up tracks, but nonetheless, there is a right way to handle things. And so in most cases, we're talking about being able to look at things through an organizational development type perspective, where both sides are seen as valuable and above. And to be above board, it means we need to consider everyone's happiness in this. And so that's all the kind of stuff we're going to get to dig into today. As part of my lecture, we're going to talk near the end about the assignment that's due this week, so it's important to hang out for that. And then at the very end, we're going to touch on the final exam as well. So like I said, today we're talking about risk and crisis communication. And so imagine we're all part of a community that faces all kinds of challenges and uncertainties. And that is the truth, we are. And what's our role? Well, our role is to communicate effectively, to safeguard and enhance the well-being of this community, to make things okay. Sounds important, right? And because indeed it is. And so imagine yourself working on behalf of a health institute or a hospital, and needing to get the messages out to people so that they understand it in a way that would benefit society. And we think about all of this all of what goes into science and medicine, and to think that just because of a communication problem or a communication or a miscommunication, we can end up without the opportunity to take advantage of that. So that's why it makes it such a big deal. So I want you to think about risk communication as sort of like friendly advice, or the heads up that you give somebody about something that you might see as wrong. It's like saying, hey, if you don't wear your sunscreen, you might get sunburned. And this is where we talk about potential risks and try to convince people to tweak their behavior, into dodging those risks. And the aim here is to keep everybody safe before anything bad happens. And on the flip side, crisis communication comes into play when the risk we're worried about has already happened. It's already turned into a reality. And so it's like dealing with the aftermath of not wearing the sunscreen, and not, now you're dealing with having to treat a sunburn, but it's like a more large scale problem. And this could mean that you have to manage the fallout of a natural disaster, or maybe a health pandemic or some kind of crisis that impacts our community. So something big is what I'm talking about. And the goal here shifts to minimizing the damage and help everybody through the crisis as best we can. And so we're talking about risk communication on one hand, which is the planning part that goes into knowing about things that could happen. And a risk communication might be to remind people to keep emergency kits in their car during cold weather. And then the crisis communication would be to remind people of what to do when they get stuck in their car and the emergency is happening. See how it's different when we talk about the risk communication to get them ready versus crisis communication in that moment. And so I want you to imagine the difference between preparing a campaign that informs people about the dangers of, texting while driving, something like that, versus responding to a major accident caused by, somebody doing just that. So the first scenario involves the careful planning and you create materials and spread the word over time. This is classic risk communication where we're helping people not text and drive, right? The second scenario demands immediate communication to manage the situation, because crisis communication is there at its core because the damage has already happened, the major accidents happen. So that's how we can think about those two kinds of terms when our book talks about it and when we can think about it as an overall structure. And what's fascinating about these two areas is also just sort of like, in risk communication, we rely on experts who can lay out the facts and people that can persuade us with evidence. And a lot of times that happens through controlled channels like, ads or brochures, and it's strategic. And so then when a crisis happens, there's no time for lengthy planning. We need the emergency responders and leaders to step up and speak out, and in that way guide the community through press conferences and social media and the more direct approach. And it's sort of like an all hands on deck when we're responding at that point. So that's why there is this different kind of perspective and different kind of work that goes into planning for these two different types of communication events. And so our book talks about, and we're going to get into talking about the crisis and emergency risk communications model. And what's kind of cool is that the Center for Disease Control, the CDC, has this on their website. So if you go to Google and type in CDC and then crisis and emergency risk communication model, it will pop up there. And they have literature with the model that they have. And what's interesting about their communication model that they use is they show that they like to look at these situations in sort of like the same kind of way that somebody might see a natural disaster response, right? Like FEMA would look at something. So in their response, they have like a pre-crisis stage, a crisis stage, and then a post-crisis stage. And so what you can imagine already would be that in the pre-crisis stage, we would be dealing with the risk communication, and then in the crisis stage, we're dealing in crisis communication mode, right? So this already is, you can see how these things are set up to connect. And so let's talk about these. So the CDC rolls with this, and it looks like, that a lot of our government responses are based on this kind of function change and into how we isolate what's happening and what we should do or how we should operate in what mode at what time. And so at its core, crisis management can be, like I said, put into sort of this three-stage approach. And so the first stage is the pre-crisis stage. And in the pre-crisis stage, we are thinking about the preparations and plans that are put into place before the crisis, so in anticipation of the event. And I want you to be able to think about this as like the calm before the storm, where risk assessments are conducted and contingency plans are drawn up. So that's pre-crisis stage. And then the crisis stage might be something is triggered. So an event happens that causes significant damage or disruption. And this stage is the heart of the storm. So immediate responses are activated to mitigate the impact. So, for example, during the H1N1 influenza pandemic, this crisis phase, involved disseminating information, letting everybody know about information so that updates could go out and vaccine development could be discussed. And so the pre-crisis and the crisis stages are totally different modes. One is preparation, the other is the action. And then later is a post-crisis stage, and this is sort of like when the dust settles and there's an opportunity to focus on learning and resolution. And so it's an opportunity for reflection and understanding what worked and what didn't, how can we improve. And, like the response to Ebola outbreak is a really good example, because in that post-crisis analysis, we got really improved global health security measures and different preparation standards for future outbreaks. And the result of the post-crisis stage was that I, in the United States, got a lot of training as a paramedic in that Ebola isolation and working with those kinds of patients. So, the need for responders even getting that kind of training was all a result of that. And so one of the most esteemed models that we draw upon is this model that I mentioned that you can find even on the CDC website. And we have been using it since 2002, and it's just a 5-stage model that looks at a deeper breakdown of the lifestyle of a crisis, and where we can see things as just a 3-stage approach, like pre-crisis, crisis, and post-crisis. Of course, our government makes things a little bit more intense. And so the breakdown of the CERC model is what it's called by our government. They look at things like how we, of course, talked about the pre-crisis event already. And so the preparation that goes into that is pretty intense. And the public gets information in preparation for that already. So like, let's say that you're in a tsunami area, the public should get regular information about that thing. Like they would be able to see just the signs alone that show where to escape to, and then the community leadership should have planning on informing people and getting the word out on what to do when things happen, and so that there's a fast response. And I always think about exactly what's happening when you're going to fly. And so if you are flying, you can think about you're in pre-crisis stage when you're going through the debriefing and learning what to do if something happens, because in that when we get to the crisis phase, it's going to be a totally different kind of communication. So let's talk about this through the perspective of the CDC model that's on their website, that's been out since 2002. When the crisis first hits, there's sort of this whirlwind of uncertainty that happens. And so during the initial event phase, the goal is to reduce that uncertainty. And reducing uncertainty is a lot about offering reassurance. And having people that are trusted offering that reassurance goes a long way. And so we think about community leaders, people like a religious leader or a mayor or someone in the government in charge of the response. Those kinds of reassuring things are really impactful. So that's the initial event. Then there's a maintenance stage where, as that crisis unfolds over time, we maintain communication and to continue to worry with this whole uncertainty aspect, so that the public sees the steps that are being taken to manage that situation. So it may mean regular updates and progress about what's happening and safety guidelines, those kinds of things. And then as the event begins to get into the resolution stage, it's more about communicating the causes and understandings of what's happening. And so like when H1N1, that influenza pandemic, wound down, the discussion shifted towards understanding how that virus spread, like what actually happened, and the effectiveness of the global response. And then the final stage is the evaluation stage, and that's where reflection is able to find out just how well we did what we did and how we can be better. And so these models that help us break down and understand these different steps do a lot to help us understand not just the what of the crisis, but also the how and the why. Because, to learn something, it's good to break down the structure and see the skeleton of everything. And so once you can see the skeleton of how all things work, we can start to fill out the meat on the bones and be able to see how these different stages can take on different lives of their own, to have different effects with working with the public for different intended reasons. So the goal here is to think about how these all can come together. And to intersect with this, I want to talk about this article from 2010 by Reynolds, who wrote in the Journal of Business Continuity and Emergency Planning about these 6 principles for effective risk and crisis communication. And these principles that were written about here are really crucial for anybody in the field of communication, because it sets us up the right way to be most successful. And so we want to think about how each of these can be impactful. And so I'm going to read them off fast just so we can think about them as a umbrella at first before digging into the raindrops here. But be first, be right, be credible, express empathy, promote action, show respect. See, these things all seem like, principles that would make the most sense. But what can happen in a crisis is that everybody may have different ideas about what is the best thing to do. And always being credible, and always expressing empathy, and always promoting action and showing respect. These things as pillars can make a real difference. So I want you to imagine a scenario where a crisis hits. And it could be like a natural disaster or some kind of corporate scandal. And the clock is ticking. And in the public's eyes, it's all about the information that comes out on you right at that moment. And this is where the principle of becoming first comes into play. Remember, the first thing I said was they said to be first. Crises are time sensitive. So communicating information quickly is almost always important for like the members of the public. And to be the first source of information out there often becomes the preferred source. So it's about understanding that in the face of crisis, time is of the essence. And so being first to communicate not only positions you as the go-to source, but it also sets the stage for public perception. And so picture in the early hours after a major earthquake, the desperation that people have for information when they are able to get that out, even directly from the firefighters on scene on camera, or showing how to help. All of that information can be calming to the public, and also can be life-saving when we're able to get out information that people need in that moment. So the principles that were mentioned, one was be first. The second was to be right. And accuracy establishes credibility. Information can include what's known and not known, and things are developing, but it's not just enough to be first. You have to also be right. And so those accuracy things in communication build foundations of trust. And so when people are trying to manage information, when information is changing rapidly, sometimes they just have to convey what's known, convey what's still not known, and then be able to explain the dynamic. Because in that way, especially in the age of social media now, misinformation can spread like wildfire. And so saying only one part that you know for certain doesn't count it good anymore. You can't just say this is what we know and leave it at the small fact. It's better to also share what you don't know. Because as I said, that adds to the credibility. And that's what I had mentioned for that third topic is being credible. And in times of crisis, people look for sources that they can trust. And so the whole honesty and transparency are paramount. Because if you think about maybe a company that's facing a product recall, admitting that the problem's there is going to definitely take steps to preserve and maybe even enhance the company's reputation in the long run. But if they get caught lying or doing some kind of shady thing, then they're opening themselves up, big time, and people are going to hate them as being evil, right? And so, being credible sometimes means that we have to show those vulnerabilities, and again, show what we do know and what we don't know. So, be first. Be right, be credible. And then the next thing is showing empathy. So much can be done by showing empathy. And it's true that crises can create harm. And the harm that they cause and the suffering, it just has to be acknowledged in words sometimes. And addressing how people are feeling and the challenges they face also does stuff to build rapport and build trust. And so it's just that these crises are, is that a word, crises, they're human experiences. And during all of these, we have fear and anxiety, sometimes suffering. And we have to acknowledge these emotions and show that we care. And the opposite would be to imagine a company that just gives a cold, legalistic answer without any sure care. That lack of concern is something that can come across. And so it's not that we're trying to be fake. I think that any company that makes a mistake, or anybody or anything, any kind of crisis that people are dealing with, is going to rightfully dictate the automatic human emotion of empathy. So with that is also, promoting empathy. They next talk about promoting action, and giving people something to do can calm down anxiety, especially if it's something meaningful. And during a crisis, people feel helpless. And that helplessness is like anxiety. And, if you can give them actionable steps, it helps them manage the situation and it gives them something positive. You get positive direction or action. And so it's actionable advice that can work here. The last thing that the article talks about is showing respect. I think it's important to know that when people feel vulnerable, respectful communication promotes cooperation and rapport. And so in the aftermath of a crisis, how people were treated and communicated with, that stuff leaves a lasting impression and influences their trust and relationship with everything involved there. And so through these principles, I think we are able to think about being first and right, credible, expressing empathy, promoting action, and showing respect. These seem basic, but like I said, it is a blueprint for effective communication. And when we're talking about the fact that we have these emergency moments that require us to plan for the communication and then deliver a communication event process and interact with the public. And this is the time to be thinking about our standards, thinking about how we know the difference between right and wrong, because without working to interact with the public from that stand can set you up to look like you're lying to them, or to look like you don't know what you're talking about, to look like all of these other things. And so imagine the difference between being open and honest with what you know and don't know versus hedging on what you don't know and not giving the complete answers. And so I want to say that there's a new day in risk management and how we communicate with people, and that's why I am happy to talk about this as a topic for us. And when we talk about the assignment for class, I have given you an opportunity to choose one of those 6 principles. Be first, be right, be credible, express empathy, promote action, show respect. So you're going to be able to, for your assignment this week, choose one of those and then cross-reference that with the stages of the crisis. So pre-crisis, crisis, or post-crisis, like we had mentioned. And I want you to be able to talk about its significance in managing that process, so across stages. So, for example, being the principle of being right, how could that manifest itself throughout the stages of the crisis? And then for that, I want you to be able to apply that in some different ways. So to be able to help you with that assignment this week, I want to dig into that together so that we can give you a full exploration for that, explore that good together. All right. So first off, I want you to all research and understand these 6 principles. So we talked about them just now, and also your book covers them in that chapter 16. Right. So I want you to use this as your foundation. And so even if you'll focus on just one of those for your essay, a solid grasp of all of this is essential. So you want to start with the principle that, I want to encourage you to choose which one speaks to you or is most impactful based on your initial research. So it might be first, or be right, or be credible, or express empathy, or promote action, or show respect. But pick the one that you see that you can maybe write about the most passionately. And then go into like a research phase where I want you to gather information by collecting data. And you can look at articles like or case studies. And one of the things that I suggest is to go to Google Scholar for, almost all my stuff that's academic related. So I would suggest starting there and be able to see what you can find as you explore that topic to help you find various health crises that you might use as an example, and get help identify examples maybe when looking at how there are global health crises out there that have been approached in this crisis, pre-crisis, post-crisis stage. So I also give you an opportunity to take into account culture or technology, or maybe situational context. So in that, when you're explaining how the principle you chose works its way through the different stages, and you use examples for that, it sometimes might be helpful for you to also pick up on one of those, like pick up on describing a cultural element, or describing how the technology aspect took a part of that, or a situational context to that. And so I'm just saying that these are good angles that you might take. And so I want you to basically be able to analyze the effectiveness of your principle. You get that? So analyze how effective that principle is. So one that would, I think, be something that I might choose if I were to choose a principle, I might choose to express empathy. So I could write about how expressing empathy moves its way through all of those stages. And another one that is really connects well with me is to promote action. So in your development, what does that look like in each one of those stages? So be able to analyze the effectiveness in different contexts, and maybe just ask yourself how the principles apply. What outcomes happen? What resulted from that, or even the external factors. How were external factors launched into that? So it helps to pinpoint any challenges or pitfalls that you see in that, because it also helps you look at any strategies that might work out better. But when you do your essay, when you start your essay, go ahead and start with an introduction that highlights this whole risk communication principle. And then as you write, make sure to do an explanation of that principle so that folks know where it came from and how it applies in each of those areas, right? And then as you do that, like I said, you can choose a situation or technology or cultural element maybe to involve. But this essay is not just an assignment. It's an opportunity to explore how effective communication can impact that health crisis. And so no matter what role you might play in healthcare someday, or what role you have in media or your own consumption, knowing the behind the scenes of this and some of that theory can be impactful. So that's what I'm excited to talk to you about for the topic of that chapter 16, and also the assignment that goes with that. To finalize the class, one of the parts that I wanted to introduce for the final exam is an ongoing more learning as we go, and so the final exam is not a cumulative exam. The final exam is a theory exam. And so what I wanted to say is that the final exam will be an open book exam where I will ask you to describe and give examples of different theories. And so this theory exam will have 5 different theories for you to dig into. And all of these are covered in our book. And so I want to give you some of that now as a hit list, so that if you want to prepare for the final exam, so that you know what's coming, and you know what you're going to have to be answering about. Know that, again, it's essay based, and I'll be asking you to explain and give example of each theory. So social cognitive theory is one. Social cognitive theory. Another one is cultivation theory. And the third one to mention is priming theory. Also the health belief model. And then inoculation theory. So the social cognitive theory, that shows how people learn behaviors from seeing others. Okay. The cultivation theory really suggests that the stories told by media shape the way that we view the world. Priming theory looked at which looks at how the news coverage of health issues influences our knowledge. The health belief model works to predict the action that is taken to prevent or screen for or control illness by examining, things like how bad it is and how susceptible are people. And then inoculation theory is the theory that suggests that inoculating or preparing the public about potential threats can help them resist the whole persuasion thing that can happen from different ideas when the crisis occurs. So get them ready for it. So that's what's to come. I'm happy to have you working with me towards the final stretch, and I look forward to reading your responses to this week's assignment as we continue forward. Thank you all.